Every day, easily avoidable infections result in prolonged hospital stays, long-term disability, and increased resistance of microorganisms to antimicrobials, resulting in massive additional costs for health systems, high costs for patients, and unnecessary deaths. Healthcare-associated infections in sub-Saharan Africa are responsible for up to 75% of all causes of death in the neonatal period.
The environment was extremely dirty. That's the only way I can explain it. It was walking into an environment where you know that preventative measures are what will help everybody and reduce costs for everybody. But actually, we were breeding disease. We were breeding the infection, and mothers, babies were suffering because of it. And it was really horrible to see.
For close to 3 years now, Horizons Trust has been on a mission to reduce maternal and infant mortality rates, with the dream to make every pregnancy a happy event here in the Gambia.
If you look at our deliveries, there was a time before Horizon we normally recorded 100, 120 deliveries. But as I'm speaking now, we recorded more than 200 because like for last month, we recorded 266 deliveries. Month before last, we recorded 256. And then month before that, we recorded 260. So you see the improvement it has already brought to us. Not on the side of the number of delivery, but even number of neonatal deaths. Because like for this year, I could remember we recorded only one neonatal death for 2018 compared to other years when we normally have more than 10, 12, 13.
The IPC Outreach Program, Infection Prevention and Control, is designed to reduce healthcare-associated infections. It supports maternity wards in 5 government-run healthcare facilities situated in Banjul, Birkama, Fajikunda, Serakunda, and Kafuta. This area covers almost 40% of the Gambia's population, and the impact of the program is already clear.
This is one of the busiest hospitals in the country, in a sense that it is situated in one of the fastest growing settlements within the Combos. One of the most significant changes they brought to this facility is installation of the solar panels for the whole of the maternity wing of this public health institution. And that's created a lot of changes in the maternity wing of Brikama district, in a sense that whenever there's electric power supply from the national grid, the solar system is there to serve the maternity wing 24/7. And that really helps us in improving and promoting the quality of health and life of the population that we are serving. And it has also additionally reduced the mortalities, both maternal and neonatal mortalities and morbidities that occur.
To date, the Horizons Trust IPC program has provided for more than 39,000 babies and mothers, offering them care in safer and cleaner environments, thereby preventing healthcare-associated infections, including a decline in sepsis cases.
Now we are receiving a patient from private clinics to our maternity ward for delivery due to the environment, how conducive and clean the environment is. Before they were not coming there, but now, thank God. And even we're having more deliveries now.
IPC provides for practical solutions designed to prevent harm caused by infection to patients and health workers. It is grounded in infectious disease, epidemiology, social science, and health system strengthening. IPC occupies a unique position in the field of patient safety and quality universal health coverage, since it is relevant to health workers and patients at every single healthcare encounter.
But with the arrival of Horizon, that thing has been a thing of the past, because the labor ward comparing to the level of cleanliness, although there's a routine assessment that is done by Horizon, but you compare our previous assessment and then our present assessment, there's a significant improvement compared to before and now.
Enhancing skills within health maintenance teams and ensuring the provision of the necessary materials and tools has resulted in the heightened efficiency and quality of maintenance conducted by the teams.
Well, the first improvement that we have is the trainings that they train us on IPC, infection prevention and control. All the staffs, orderlies and nurses in the facility were all trained on infection prevention and control. From there, we practice the things that we are taught, we practice it in the facility.
Ongoing IPC training is successfully delivered independently by Horizons Trust-trained midwives based at the 5 facilities on a regular basis. Pictorial accounts of the training sessions are shared on an IPC WhatsApp group set up, amongst other reasons, to increase retention, recall, and learning across the facility.
Before, we used to have neonatal sepsis, a lot of them, because even if we can do the infection prevention and control here, before we did not have the cleansing materials. Government was not supplying it. Before Horizon came in, there was no cleansing materials from the government. So now, Horizon Trust, they are supplying us every quarter with all the cleansing materials that we need in infection prevention and control. So now, before we do have a lot of neonatal sepsis because of the lack of knowledge on IPC. But now, since 2016 up to now, we do not register any neonatal or maternal sepsis in the facility.
There has been a recorded 25% increase in knowledge about IPC measures and competency of health workers, including orderlies who never had training opportunities before.
mume bole uniforme on nabi kata suwo kon nka uniforme ol ku janne labi je mi yalla ko ninga uniforme ol ku ninga bandi sa samba nge mume samba ngane landi je ninga wudra nimme sela suwo kono nganna fengol dun ni wolita suwo kono wotumo ngaje nimbitala hani uniforme on nastano suwo kono bar wotumo londo man wara fahamo fana ma wara sangile ngaje fahamo warta bidimbulata nyim porje ko kono.
National IPC trainers have increased from 5 to 8 through a 3-week training program developed for Ministry of Health staff, who were selected from their epidemiology and disease control unit. All 8 can now train IPC facility-based trainers, lead the national conversation on IPC, and provide a nucleus for the national training model on IPC.
The impact that we've seen is very difficult to capture in before and after pictures because we do a lot of physical things, provide cleaning materials, we maintain anything to do with sanitary appliances. Inspiring thing that I can see when I go is the culture change, because now people actually are aware of what it means to keep an environment clean and what that then prevents. So you see it's a completely different, especially at our smaller facilities, it's a complete different environment. You walk in and you understand that these people actually care about what is going on and somebody is looking after this place.
IPC facility-based trainers increased from 13 to 28. These are midwives and nurses tasked with training their fellow health workers, including cleaners and doctors, on IPC best practices. For the first time, Horizons Trust have trained community health workers, creating 25 new IPC community educators who will be raising awareness within their communities with an introduction to harmful germs and how they spread, their impact on health and standard precautions to take when at home and within a health service facility.
ñun ñu nekk di jàngale ñun jigéen yi ak jaboot ji ñëpp su fekkee noonu lañ ko nekk di seetaan ñu jëfoo ko xam naa ne feebar bi na wàññeeku lu bari ci biir dëkk bi ndax xam nañ ne léegi uniforme wartoo dëkk dem ak moom ci biir dëkk bi di war ak moom warloo boole say uniforme ak yére nga fóot te warloo digg ak moom ci biir public ñun de man de dimbal nañ ma man private man suma boppa dimbal nañ ma torop na man noosi rek lay jëflanteel ak orli.
Unaware of the serious risks to her family's health, Tuti had her children help with hand-washing hospital garments and uniforms, and she washed contaminated items in the same basin as her family clothes. The personal hygiene module taught at the IPC training has changed how she now handles the uniforms ensuring that she takes care on how she transports contaminated clothes home, washes his clothes separately, and most importantly, ensures that her children and her family items never come into contact with contaminated clothes anywhere. She says she is grateful to be able to protect her family and to share what she has learned with her community.
We know the cleaners, they are very much appreciative of the materials that are provided to them to do their daily cleaning. And then beside that, we do talk to them, we do organize an in-house training periodically to make sure that they are always, how would I call it, their minds will be fresh with regards to what was taught to them and then how best they can do the cleanliness and then make sure that everything is safe.
Achievement was the trainings that we had. All of us are now IPC conscious. At least sometimes even you, the nurse, if you want to do something that is not correct, they will tell you, no, this Horizon said we do this, not this. So that is a very good improvement in terms of the facility.
Dignity has been restored for the mothers who deliver at these facilities. They can have showers, use the toilets, and wash their hands at their convenience as a result of the ongoing maintenance support the Horizons Trust Initiative is providing.
Kanni wulu da leptanor ni ndi na no problemo soto itero kalon enyante ma ko le nyamin dole kalon ani ndi na ma problemo so wala ni da ba fon problemo so e ka jele ka jara lo soto je ha.
Quarterly IPC assessments have shown an increasing percentage score, currently about 75% compliance by each facility.
So now they really pushed, and that's where we're moving towards now, where we're involving the community in the training so that they also have an idea. And it's amazing the stories we hear about how mothers are behaving differently within the facilities and not doing certain things they were doing before, which were harmful to them, but they didn't know. So for me, I think the fact that we're now being led by the facilities, they are identifying where are the major gaps in terms of knowledge. If we depart that knowledge, we're all working towards the same goal. And that's what we're achieving now, where the people that are coming into the facilities, because we do outreach work in the communities, are actually coming in with some level of awareness and knowing that when I come into this facility, it's a hazardous environment, I need to take care of myself. So yes, there are staff here whose responsibility is to keep this environment clean, but I also have a responsibility. And together, which is when it actually comes together and works well, it's when the community and the healthcare workers are doing it together. That's where we've seen the greatest impact.
Building on the current successes and the momentum created by the program, it will evolve to strengthen its focus on capacity building at every opportunity, using IPC as the vehicle to develop leadership and management skills in healthcare workers at every opportunity. This new approach will see Horizons Trust take on a more facilitative and mentoring role, whilst the facilities take the lead in implementation. This new approach will see facilities continue to train their health workers on IPC independently, carry out assessments in their own facilities and other facilities, identify their own problems and needs, articulate requests for support to meet their needs, write sound proposals based on evidence, be introduced to a performance-related reward system, and see their direct input determine the level of support the facility receives.
Nadoko watumo nadoko benyamin kana fitaro la dulal to kadulal sinian. Bara watumo nadoko nganyame fenjama yenda sajel. Tado safuno tado nyimpompo tado as problemo soto. Kata jebi na pompo kolongo to ka samba nan kana do ko la ja.
Horizons Trust has proven that it doesn't take much to make a difference. But with your support and their dedication, much more could be done to stop preventable deaths in the Gambia.